The Georgetown Public Hospital's nephrology and kidney transplant department team are boasting on an achievement which in the past was deemed as impossible for Guyana. Not only is the team celebrating its ability to conduct 2 successful kidney transplant surgeries in June, but they are also celebrating the fact that one of these patients was the first non-national Grenadian doctor, Jermaine Bristol, to receive a transplant at the Georgetown Public Hospital. As such, to mark this milestone, the team was on Monday publicly honored by the Minister of Health, Dr. Frank Anthony, and the advisor to the Ministry of Health, Dr. Leslie Ramsamy, as well as the administrative staff of the hospital. In providing a background to the medical feat, it was conveyed by the head of the nephrology and kidney department, Dr. Kishore Prasad, that this step is proof that Guyana can provide optimal medical care comparable to first world countries.
Today, we are here to show that we have not only achieved it locally, but we have risen to the standard that we can take one of the most challenging patients from our partner CARICOM country and a young doctor from our own country, Naimiki Griffith, she's also here, and transplant them successfully.
Opining that it is only the beginning of successes for transplantation in Guyana, Dr. Prasad extended gratitude to the government for investing in the department, despite past beliefs that transplantation would never be locally achieved.
On behalf of all of us, we want to recognize, sitting right next to me, Dr. Leslie Ramsamy, who was the then Minister of Health, that believed today was possible. Dr. Ramsamy, your vision for Guyana has materialized.
Minister Anthony lauded the many notable achievements of that specific department throughout the years.
Over the last 6 years, a fantastic job, despite the many challenges and odds that they face. The government of Guyana is committed to ensuring that they are given the tools so that they can enhance their work.
Dubbing the achievement as historic, the minister assured that the government will take the steps necessary to ensure the advancement of transplantation in Guyana.
One of the things that we also want to do and to ensure that we are able to continue transplant not just here in Guyana, but for it to be recognized internationally, is to make sure that we have the right pieces of legislation in place.
Meanwhile, Dr. Jermaine Bristol, in expressing gratitude to the government of Guyana and the staff of the hospital, classified the encounter as a new lease on life. Bristol, whose surgery was completed on June 14, is expected to make a full recovery. While the team celebrated Dr. Bristol's surgery, it also marked another successful transplant done on a local medical professional, 26-year-old Dr. Naimiki Griffith, whose surgery was done on June 20. Griffith, like Bristol, is expected to make a full recovery. For the HGP Nightly News, Kendell Richmond.